my sunscreen of choice is Lumisol. Yes, there it is in the box. This is a great product, SPF 50. So simple to use because you got to reapply and just kind of put it on. It goes over makeup. It works great. Protect yourself from the sun with Lumisol. All right, today, first of all, thanks for watching the YouTube channel. It is in the dermatology office with Caitlin Jenner. Yeah, I get checkups often, and so I got to run into Beverly Hills, get a checkup. But the reason I'm getting the checkup is I've always had this little problem right here with basal cell carcinomas, and I don't know, for the last few days, it's been getting a little bit red, and it's kind of scaring me. And plus we'll do a couple other little things. I got a couple of little whiteheads. But anyway, we're gonna go to the Beverly Hills early morning, go to the dermatology office. So let's get in the car and let's get it going. All right, got my Starbucks. Yay! We can make the long drive into Beverly Hills. Okay, it wasn't easy, but I made it to the doctor's office. I gotta wear masks, temperature. I had to call downstairs to have them come and get me in the elevator. My God, what do you have to go through today? Just to have them look at a few things. But anyway, I think I passed. Temperature's good. And now we're gonna have him kind of check out the nose, the top of my head right there, which is a lot of sun exposure. You know, when I was a kid, I never wore sunscreen. I grew up and my gosh, I was outside my entire life. And anyway, and so unfortunately I'm paying the price now. So I just got to keep a good eye on all the little spots. So that's why I'm in here to see Dr. Lancer. Now, why Dr. Lancer? When I was looking for a dermatologist, who did I call? Yes, Kimberly. Kimberly, I figured she would know the best dermatologist. And so I called her and she said, you got to go to Dr. Lancer. So anyway, I've been going to him for about probably the last 3 years, 4 years, checking out on all the little things. And anyway, because Kimberly has perfect skin. Yeah. So anyway, that's what we're doing in here. This is good. They actually let me take my stupid mask off. But anyway, I'm safe. Anyway, we're gonna have them look at my little nose right there. That's the little red spot. Gotta keep a close eye on that, yeah. Look who has come into the office. The great one. Dr. Lancer, good to see you. I haven't seen you in a while.
Where have you been hiding?
Where's everybody
Malibu.
been hiding?
Yeah.
Yeah, I've been hiding in Malibu. It's been kind of tough.
You know, it's funny. Everybody's been hiding somewhere.
Yeah, everybody's been hiding. How long were you down? Close.
7 weeks. Voluntarily down for 7 weeks because it was socially appropriate.
Oh, you are socially appropriate. Well, you know,
Which is rare for me.
Yeah, you got to take care of your skin. Yeah. Well, welcome to my YouTube channel. This is this is exciting.
Is this it? Whoa.
Yes.
Hello.
Yes. Hello, everybody.
Hello.
Dr. Lancer. Yes. Reason I came back. First of all, some of the things on the top of the head, which are kind of normal, good old sun damage, and our little place right here on the old nose. I noticed over the last couple of weeks, it's got a little red, and I thought, you know what? This is the kind of this little place that we got to look at.
Let's see.
All right, go check it out.
Okay, let me see. Where was the problem before? I can't even remember.
Right, it was right here. Now, years ago, I had it all cut out. You know, the basal cell had it all cut out. And they had to take all the skin off my nose and redo my nose. I don't want to go there. Then it got a little bit, probably 4 years ago, you gave me that cream.
Yeah.
And we put it on, and my nose blew up. I looked like Rudolph the Red-Nosed Reindeer. And I'm just wondering if it's slowly coming back.
Well, I think the smart thing is, since it's an area of previous problem,
Yeah.
I have to rebiopsy it. That's the intelligent thing to do. So I have to take a little scraping from it.
Okay. Well,
I
see,
think
I just honestly, I've only noticed it the last couple of weeks. That's why I came in, so I want to get on it quickly.
Well, it's not going to go away with prayer, so we have to find out what it is and then make it go away.
Okay.
You know, otherwise, I think you look great.
Well, thank you. Not bad.
Wow.
70, hitting 71 in 2 months.
Yeah, I think you look great. You haven't done anything.
Say that again. We're up nice and close. I think you look great.
I think he looks great. She looks great. They
Yes,
look
yes, I
great.
know.
Everybody looks great.
Yes, that's exactly it. Yeah.
I think you look terrific.
Well, thank you. Thank you.
You haven't done anything crazy since I saw you last? Procedurally?
Absolutely no.
I think you look naturally very good.
Well, thank you. Thank you. No, it's, I'm pleased at where I am in life. I'm pleased with the way things have
I'm
worked
saying
out.
the overall shape, the color texture, everything is very good. There are multiple small crusty spots
Yes,
all over.
I know.
From years of sun exposure, obviously.
Now, in your business,
Yeah.
is sun exposure keeping you busy?
It'll always keep me busy.
The last time I came in and you put that, whatever that chemo cream was on, it was great until about 6 days in, my nose blew up like Rudolph.
Like a
Yeah.
tomato.
And of course the media got a picture of it. And so I decided, let's just do a Instagram post and put it out there on the Instagram post, you know, like effects of exposure to the sun, wear your sunscreen. And the reception was so big. You're numbing my little nose?
You're tough. Because
Yeah, just scrape it.
because I numbed that over there and you didn't even wince.
Yeah, I know. Yeah.
All right, the same's going to be here.
Yeah, just a little.
Trying to be gentle. Let me, I need 2 Pureps. Let me have one for the skin.
For all you young people out there, wear sun protection.
How old are you?
71 in October.
You really look fabulous.
Well, thank you.
Yeah, you really do.
That's why I come
Really
to you.
good, yeah.
That's exactly why
And
I
it's all
come to you,
Lancer
Dr.
skincare,
Lancer.
that's why.
I know.
I figure if I can biopsy the big one, it'll be representative of
Yeah.
what the little colonies are.
Gotcha. The colonies. I got a colony on the top of my head.
So you see the white areas from the anesthetic,
Right.
contracting the blood vessels, and then it actually shows you the island better.
Oh, yeah.
So it's outlined it a little bit better. So we care what this is. But you know, it's interesting. If this is an area that's had tumors before
Right. And cut out.
and cut out, the treatment we did actually worked very well because I can see there isn't a whole lot of any scar tissue. So this, I think, is what's called a de novo, new cluster of skin cells that's probably in the squamous cell carcinoma in situ category.
Well, that sounded good.
Yeah, it sounds good. Yeah.
Yeah.
So there are sun damaged cells that are superficial. So if it is what I think it is, then we'll treat it probably the same way with a little bit of laser. Not
right.
cutting and stitching. It'll be laser and a little bit of the stimulatory cream.
All right. Because I just don't want it to get worse. So I came in early.
Yeah, we can't ruin your good looks.
No, God, no.
No. All right, so you can hear it.
Oh, I can hear it.
But let's just find out what it is. But the remaining area all looks really quite good.
Yeah.
And we'll do maybe the laser for the red vessels.
Why not?
Yeah.
Every time I come here, I look worse when I go out.
Yeah, well,
Jesus.
you have to...
You got to go backwards before you can go
it's
forward.
construction.
I got you.
Construction.
Okay.
Have we enjoyed ourselves? Great.
It's fabulous.
I'm glad you came in early to biopsy the nasal tip, because if it's in its superficial phase, it'll be much easier to treat.
Yes, I totally agree.
Because
I've only noticed it the last couple of weeks.
Yeah, because we don't want a major event going on in the nasal.
And you were my first phone call.
Most people say that. All right.
Good.
Good.
All right, Dr. Lancer, thank you.
Our pleasure.
See you Monday. Wait, this, I look worse now. There it is. Yeah. But the good news is it'll heal. And we're on it. Yes, we're on it. This is a lot of work. Anyway, wear protection from the sun. Hopefully it's Lumisol. Sophia's done a great job with the company. But, so when you get to be my age, you don't have to go through all this stuff. But anyway, the dermatology appointment is over for now. Now it's just about healing. Okay, now it's Monday. We are back at Dr. Lancer's. Yeah. Back at the dermatologist to find out what the results are from my biopsy on my nose. See, it's looking a little better. And on the top of my head to see what the treatment's going to be. This is a long process. But anyway, we're going to find out the results. We're just waiting for Dr. Lancer to come in.
Are we ready?
Here he is, the great one.
Excitement coming.
Excitement is coming. Okay, what is the diagnosis? Oh my God, look at this. You're putting on gloves. All right, so what's the verdict?
Let me see. Healing quite nicely, I must say.
I do heal good. Well, the results are?
The results are, on the scalp, the runner-up.
Is the runner-up, okay.
The runner-up is the scalp. So that is hypertrophic actinic keratoses means...
Jesus, that's a big... You guys have big names for these things.
Means that it's a big named cluster of lots of sun damage that's barely invasive. That's why they're growing above the surface more than below.
I got you.
So the ideal treatment for that is we'll freeze some of them, and then the rest of it needs to be done with light treatment called PDT.
Now, this is not going to make my hair fall out, because the last time we did something on these, you know, you said, oh no, your hair's going to be fine, and it wasn't. But anyway, that's a whole nother deal.
Well, the hair's fine. I mean, it looks great to me.
Okay, well,
right. Maybe it made the hair grow better.
Yeah, maybe. Okay.
Maybe. All right, so in any case, now the nose is called a squamous cell carcinoma in situ, meaning it's a skin cancer that's not invasive. It's superficial. So it means that it's not the good news is, it means it's not a recurrence from anything before, that this is new sun damage that's developing in an area of previously treated sun damage.
True.
So we will rapidly laser that, and then I'll give you the magic cream that you use twice daily for 5 days.
Oh no, not that. That made my nose blow up last time.
It's the Rudolph look.
It's okay.
Okay, but that's a whole lot better than what that could have been.
Oh, okay.
That would have been, its sister diagnosis would have been bad news. So it just saves us a lot of grief.
The last time you knocked all my hair off the top of my head.
No, I did not.
Oh, you did too. The icing, huh?
I'm just getting the big ones.
The
there.
big ones?
Yeah. The big one, the California expression.
Yeah. Now, for the general public, you deal with this stuff all the time.
Yeah.
When it comes to sun damage like this, what's the most important thing?
In the
Just
world
keeping
of,
an eye on it? Ouch.
In the world of, I'm done abusing this area. See, and depending on how you style the hair, you
style
can't
the
even
hair,
see it.
yeah.
All right, anyway, probably 30% of the things we do in this office have to do with pure cosmetics. Probably 30% have to do with pure medical. And then the remainder has to do with some sort of malignant issue, whether it's melanomas, squamous cell carcinomas, et cetera, et cetera, et cetera. In the world of sun damage, most sun damage starts in the first 5, 10, 15 years of life.
Oh,
yeah.
Okay.
So it's not just in the adult years. I must say, you're a phenomenal patient.
Well, thank you.
I must really say that.
Yeah. Not all your patients are phenomenal.
No.
Are they all crying and, oh my God?
A lot of the patients pass out. sometimes.
Pass out!
Some of them have to be given cocktails.
Oh, wow. Yeah, well, cocktails aren't bad.
Yeah, well, maybe we should get a liquor license.
Maybe you should.
You know, because just injecting narcotics won't help some people, but maybe martini.
A martini, that'll do it every time.
So you see what I want to do is, if I numb it up, I can sort of like rake the leaves a little bit. It'll let the laser work a little bit better, and it gives me a second look at the tissue.
This is it. On my YouTube channel, I bring it all. The good, the bad, and the ugly.
Right. All right. Deep breath in.
For anybody out there, if they see something, early detection, not letting it go.
Well, there are people who call me just for the hell of it.
Oh, I know, yeah. I'm sure I got a few in my family.
Yeah. You have a whole bunch of family members just calling me up to chat.
Yeah, just to chat.
You're not planning to broadcast this, are you?
We're going on a YouTube channel, babe.
Oh. Done. Now you see, in the real world of dealing with
It
real
smells
patients,
like burning flesh.
So if I say something offensive, you can take it out.
No, I leave that in.
Oh, okay. Yeah, some people call this the Jesus procedure.
Mm-hmm. That is bright.
Yeah, there's a bright green reflection,
Mm-hmm.
even when your eyes are closed and little shields are in place. Because there's a reflection of light that still stimulates the optic nerve.
I tell you, this vanity thing is a lot of work.
It's a real job.
It's a full-time job.
Right. So take a peek.
Oh, yeah.
Yeah.
My God, you destroyed me.
Yeah, so we'll let this heal up and
Good
this
thing
and
I
this
got
and
nothing
this.
else to do.
You've done incredibly well.
Oh, thank you. Thank you. I'm a good patient.
You're the best.
Yeah, good.
A charm.
Thanks, Doc. Have a good day.
Bye.
I'll go deal. The saga continues. I'm done for today. Ooh, now I remember the last time I did this. This stuff, I mean, works really well. It also raises havoc with your poor little nose in about a week. All right, we're gonna let that kind of settle in for a while, and then we'll probably put a little Band-Aid over it, maybe a little Neosporin or Accuphor. Put a little Band-Aid over it. I gotta do this twice a day, so I'll do it again in the morning. And you know what I'm gonna do? I'm gonna spare you people, okay? You don't have to see this all the time. I promise you, eventually, I'm gonna do a glam video that I look absolutely fabulous. But for right now, we gotta take care of the sun damage. All right, I'm going to bed.